Hello, my name is Seema Madhavan. I'm a registered nurse enrolled in the dual-track Master of Science, Masters in Public Health at Hunter College, City of New York. Today, I'm going to be presenting a population assessment on LGBTQ elders. For the purposes of this presentation, the term elders or seniors applies to anyone age 65 or older. So what is LGBTQ? The following definitions come from the Human Rights Campaign's glossary. LGBTQ stands for lesbian, gay, bisexual, transgender, and queer, although the Q may also stand for questioning, which is a term used to describe people who are in the process of exploring their sexual orientation or gender identity. The term lesbian refers to a woman who's emotionally, romantically, or sexually attracted to other women. Gay refers to a man who is emotionally, romantically, or sexually attracted to other men. Bisexual is a person who is emotionally, romantically, or sexually attracted to more than one sex, gender, or gender identity, though not necessarily simultaneously, in the same way, or to the same degree. Transgender is an umbrella term for people whose gender identity and/or expression is different from cultural expectations based on the sex they were assigned at birth. Being transgender does not imply any specific sexual orientation. Therefore, transgender people may identify as straight, gay, lesbian, bisexual, etc. And queer is a term people often use to express fluid identities and orientations. Health disparities among the LGBTQ population cannot be understood unless one learns about LGBTQ history. Homosexuality was classified as a mental disorder until 1973, and being transgender is still classified as a mental illness. According to Healthy People 2020, LGBTQ people face stigma, discrimination, and denial of their human rights, and suffer from high rates of psych disorders, substance abuse, and suicide as a result. Personal, family, and social acceptance of LGBTQ people can impact their mental health and personal safety. Efforts are underway to collect sexual orientation and gender identity data in order to identify and reduce LGBTQ health disparities. However, many people, especially the elderly, may not wish to disclose their LGBTQ status due to the way they've been treated through the course of their lives. Because many people live in countries where being LGBTQ is outlawed, punished, and criminalized, data regarding how many LGBTQ seniors live globally is almost non-existent. The data that exists is for individual countries or continents, but that data leaves out all the areas of the world where self-identifying as LGBTQ could mean risking freedoms and even their lives. Here's a color-coded map published by the International Lesbian, Gay, Bisexual, Trans, and Intersex Association showing which countries criminalize LGBTQ people. In the United States, there are 1.5 million people who identify as LGBTQ age 65 or older. By 2050, the number of adults over 65 identifying as LGBTQ is estimated to double to 3 million. In this table from the New York State Office of Mental Health, the term LGBO is used instead of LGBTQ. LGBO stands for lesbian, gay, bisexual, or other. According to these tabled results of a patient characteristics survey conducted in 2013, almost 4% of all LGBO persons in New York State are 65 and older. However, it's noted at the bottom that 12,559 people were excluded as they reported their sexuality unknown. This demonstrates just how difficult data collection can be, as sexuality is a spectrum rather than a precise set of labels. This figure shows the percentages of heterosexual, gay, and lesbian or bisexual people in each age bracket in New York City. There is no further information regarding local New York City statistics for elderly transgender people because, according to a study by the National Center for Transgender Equality and the National Gay and Lesbian Task Force, 71% of transgender people said they hid their gender or gender transition to try to avoid discrimination. According to this table, in 2014, a total of 2.1% of all people aged 65 or older in New York City identified as gay, lesbian, or bisexual. Here are some relevant determinants of health to the LGBTQ elder population: societal norms and attitudes, social support, availability of community-based resources in support of community living, socioeconomic conditions, and social and community context. So going a little more into depth, employment discrimination and marriage inequality can lead to limited healthcare access among LGBTQ elders. LGBTQ elders are 4 times less likely to be parents or be close to their families than other older people, which means a risk of social isolation. Senior care facilities lack LGBTQ competency, leading to more trauma that can potentially push LGBTQ elders back into the closet in their later years. Transgender people are 400 times more likely to live in poverty than the general population. And finally, LGBTQ elders of color experience more disparities due to intersecting minority statuses. The impacts of the aforementioned determinants of health can lead to challenges in healthcare delivery for LGBTQ elders. LGBTQ elders have experienced profound stigma and discrimination throughout their lives. Negative healthcare experiences can equal a mistrust of health professionals and an avoidance of necessary services, including cancer screenings, substance cessation assistance, and testing for STDs. The following are some recommendations that might help improve health outcomes among the LGBTQ elderly population. LGBTQ inclusivity training should be required during all educational and career orientations, just as HIPAA and cultural sensitivity training are. Healthcare professionals should be held accountable to their responsibility to provide patients with safe spaces. Gender-neutral dialogues need to be normalized, such as the use of the words partner, spouse, or significant other rather than husband or wife. There needs to be a continued push for legislation supporting LGBTQ and human rights. And finally, LGBTQ sensitivity specialty and certification for gerontology and palliative care providers would help meet the needs of this vulnerable population and would be an asset to the healthcare arena. In conclusion, a well-informed LGBTQ-affirming healthcare workforce could greatly improve health outcomes among the LGBTQ population. LGBTQ elders, who are particularly vulnerable, would be more likely to seek care if the care provided is inclusive and affirming to their unique needs. Thank you for watching this presentation. Goodbye.